Good morning, ladies and gentlemen, to all of you here in the room and to anyone joining us online. I want to welcome you to this stakeholder session in which we'll be highlighting achievements and challenges in global health. This outstanding panel, whom I will introduce to you in a second, will explore the important and clear links between health and prosperity. And we are at a crucial moment for global health. Over the past century, global life expectancy has more than doubled due to advances in vaccines, medical treatment, preventative care, nutrition, bolstering both well-being and economic prosperity. And yet, despite this remarkable progress, the world faces persistent and emerging challenges. Health systems, unfortunately, grapple with disparities in access to care, and that goes across the globe. The rising burden of chronic disease, again, across the globe, and the escalating impacts of climate change and public health. Compounding these issues are, of course, the persistent threats of pandemics, antimicrobial resistance, and inequitable integration of cutting-edge technologies across the globe. So how can leaders coordinate efforts to further implement the use of cutting-edge technology and data to improve public health today? What are the prerequisites for a resilient, equitable, and sustainable global health future? My name is Magdalena. I am editor-in-chief of Nature. And let me introduce this fantastic panel we have with us today. From left to right, we have Prime Minister of Spain, Pedro Sánchez. We have Vaz Narasimhan, Chief Executive Officer of Novartis. Next to him is Sania Nishtar, Chief Executive Officer of Gavi. Then further along is Peter Sands, Executive Editor of Global Fund to Fight AIDS, TB, and Malaria. And at the end of the panel is Adar Poonawalla, Chief Executive Officer of Serum Institute of India. Prime Minister, let me start with you. Spain has demonstrated a strong commitment to global health, including significant contributions to Gavi and the Global Fund. How is Spain fostering innovation and the use of advanced technologies within its own healthcare system? And how can these experiences inform global health inequalities?
Well, first of all, thank you very much for this question. And of course, thank you very much for your invitation. I think that the COVID-19 pandemic made it clear that health is not an individual issue, but a collective responsibility. And this is also something that we can apply to innovation in two things, essentially. First, governments, the public sector, have a responsibility to ensure that the innovation model addresses health needs and also accessibility. Today we are witnessing a revolution in technology that offers new hope for improving global health, but profitability cannot be the only driver for innovation. So public health is a fundamental pillar for the development of new medicines and health technologies. I do believe that it is not true that the public sector cannot innovate. On the contrary, a public and a coherent healthcare infrastructure, it is a prerequisite for innovation in collaboration with the private sector. My country is currently the leader in clinical trials in Europe and the third in the world. Thanks to a network of internationally recognized centers of excellence and an extensive hospital network. And of course, our primary care network has an important role in supporting the research. And second, public-private collaboration is essential. Spain is investing in this approach. We launched back in 2021 an innovative public-private collaboration project in health, the strategic project for Vanguard Health, with more than 2.5 billion euros invested. And we have just launched a pharmaceutical industry strategy in collaboration with the main pharmaceutical associations. The aim is to promote innovation and equitable access to medicines, particularly in advanced therapies and precision medicine. So, I think that this approach of public and private cooperation is essential in order to move forward in this innovation approach that you were asking.
Really interesting and important examples. Thank you for that. And I really appreciated your comment and emphasis on the fact that you believe that innovation can happen in the public space. I think that's really important to remember. And of course, that emphasis on public-private collaboration, where each of the stakeholders brings something new to that collaboration. And in some of the other sessions, we've heard about this important tension between collaboration and competition, and how the two, when in balance, in healthy balance, can stimulate really innovation. So let me follow up with a second question, and that is, in your examples, you actually illustrated already that Spain is leading in international collaborations. For example, you talked about clinical trials. What are the strategies that are being implemented to support those international collaborations to address health challenges and potentially disparities in the world? Because, of course, what you and your government implement in Spain can be a wonderful example for the globe.
So, first, Spain has supported, and we will continue to support global health initiatives such as Gavi and the Global Fund. I think that this represents a joint effort by governments, by the academia, by multilateral organizations, by civil society, private initiatives, united to improve access to health services needed to realize the right to health. No? And second, we will also promote a more inclusive, efficient and transparent global health governance that allows for better outcomes and results. What we are witnessing is a change, Magdalena, in the cycle of financing for global health that implies risk of regression in many parts of the world. And I think that we need to reverse this trend. And for that, we need to be more efficient. And in this regard, innovation can play a critical role in this context. Global health governance responds to a multiplicity of actors and instruments that need to be harmonized. And we will support multilateral, effective, democratic and representative governance with the World Health Organization at its center. No? And last but not least, what we want from Spain is to consolidate ourselves as a strategic partner in international cooperation and global health governance. We're working on a whole of government global health strategy to bring more coherence among Spanish stakeholders. And I'm very happy to express our hope that after 20 years, Spain will return to the Executive Committee of the World Health Organization in 2025 with a clear aim, which is to promote health as a global policy and a primary care approach to effectively address the changes the challenges of changing the social determinants of health, climate change, and of course, mental health.
Thank you for sharing this with us, and this is, of course, a great opportunity that's very clear you approaching very seriously. And thank you also for weaving into the conversation the governance, the importance of global governance of global health, and the finance, reimagining the finance. I think that's an important topic, which is, of course, a very large topic in and of itself. Let me move to you, Vaz. So Novartis is looking in new ways, at new ways for utilizing technology to transform global health. How is your organization integrating these technologies into your global health strategies to enhance prevention, diagnosis, and treatment? So right across the spectrum of considering disease.
Yes, thanks, Magdalena, and it's really an honor to be on this panel. We actually are the largest operator of clinical trials in Spain, so congratulations, I think, on building a great ecosystem in Spain. You know, for more than a decade now, I think there's been recognition through the global burden of disease, I think other metrics, that non-communicable diseases are now really the primary challenge facing low and middle-income countries. The challenge is accelerating. Healthcare systems are likely not prepared for the onslaught that diabetes, hypertension, hypercholesterolemia, cancer will place on these healthcare systems. And at the same time, many of the challenges we face tackling these conditions in the developed world will only be exacerbated in developing countries. Early diagnosis, it's hard in US and Europe, needs to be even earlier, I think, when you're in some of the settings that we talk about here. Getting compliance for medicines at an adequate level, making sure patients stay on their medicines. Now, what I think is really exciting is that now we're entering an era, or actually already in an era, where technology can actually solve many of these problems, and actually at a low cost. I mean, when you look at now the improvements in diagnostic technologies, if you take just the example of cancer, our ability to do early detection of cancers is improving at an astonishing rate. Our ability to detect certain cardiovascular risk factors is easier than it's ever been before. And then when you think about therapeutics, in most places around the world still, of course, today you have to take hypertension medicines every day, cholesterol-lowering medicines every day, diabetes medicines every day. But with RNA therapeutics, we're actually entering now a world where you can give these medicines maybe twice a year, maybe once a year. So suddenly a patient outside of Accra in rural Ghana no longer has to come back to the district health center every few weeks for the refill of medicine, but maybe could just get their very low-cost siRNA therapeutic once a year to manage their chronic disease. And that's something that's relatively recent. And in my mind, in the same way 25 years ago that we created the Global Fund, we created Gavi to bring technologies that we were developing in those days, new vaccines, new malaria therapeutics, new HIV/AIDS medicines, to people around the globe. I think now is the moment where we need a global fund for non-communicable disease. We need an alliance for diagnostic introduction for non-communicable disease. If we don't start to create that infrastructure to enable tackling non-communicable disease at scale, we will be 10, 15 years behind the curve. And I think there are very progressive governments that are already thinking along these lines. But I think technology can now hopefully overcome many of the challenges that we've faced over decades to tackle non-communicable diseases at scale.
Thank you for this. And you very beautifully illustrated how superficially the same disease challenges or health condition challenges can present or necessitate very different solutions in terms of diagnosis and deployment of treatment in different parts of the world and sub-regionally also. I think this is really, really important to remember. I liked the way you talked about technologies generally, and if I may reveal part of the conversation we had before the start of this, you very intentionally did not mention AI specifically. Yeah. But some of the diagnoses you talked about in some other sessions, sure. We talked about the great advances in, for example, bio-inspired materials of detection, continuous monitoring, which is very non-invasive and indeed increasingly very affordable. So these are really, really important points. I want to ask you another question. So both in terms of diagnosis and treatment, of course, we're talking about rolling out these approaches to a population, but that population involved consists of individuals who may or may not wish to participate and engage. So Novartis actually has a strong focus on this patient-centric solution provision and development and access programs to ensure that these medicines, these innovative medicines, are accessible to those in need. So I want to ask for your view. How do you imagine the different sectors in the health ecosystem, so the public, the private, the civil society, how can they work together effectively to improve that access and equity?
I mean, I think access, of course, is the key question. It's very easy for me to sit here and talk about these breakthrough technologies, but it only matters if it reaches the last mile in every one of the countries that we talk about. Novartis has a long history in access to medicines, huge focus. We were ranked #1 in the Access to Medicines Index this year because of our work getting new technologies to low and middle income countries. I think one of the key learnings that we've had is that it's not enough for us just to put those medicines out or those technologies out at a low cost into a country. We tried that. We signed agreements, I think, with over 15 African countries, package of non-communicable disease medicines at a low cost that weren't used. Because what we didn't do is really bring together all of the stakeholder groups that need to tackle these challenges. And I think until you bring together government, civil society, physician organizations, it's very hard to make this happen. But you can make big things happen in non-communicable disease. I'll outline the success we've had with sickle cell disease. So a few years ago, we took on the challenge. In most parts of the world, sickle cell disease is diagnosed at birth, treated with very low-cost medicine, so the children with sickle cell disease don't have to suffer for so long in their life and hopefully can live more normal life expectancies. Most African countries did not have these kinds of programs in place. Through a consistent, concerted effort, I believe now we've reached 7 or 8 countries with sickle cell early diagnosis programs. The medicines are available at very low cost so that children can get them. We worked with physician organizations, we worked with government, we worked with NGOs. In some cases, we even worked with drone providers. And we're able actually to tackle it. Multi-year effort, multi-stakeholders. But it can't just be, it's not so simple as to just say we're going to just push these medicines into a country. It really has to be a thoughtful approach. But I think we can do it. And I think if we start to tackle this systematically, we can move the needle on non-communicable disease.
I just want to emphasize what you're describing. You're describing a system which is only really set up for success if it really takes in diverse expertise. You just mentioned drone providers and drone-based delivery, for example. And of course, sometimes there is a temptation to forget that civil society, the engagement of community leaders, which is so essential in the setting that you talk about, and it's terrific to hear that Novartis is engaging in this way. Sania, I'd like to turn to you now, and I'm going to start with wishing you happy birthday, because of course Gavi is celebrating its 25th anniversary. It was launched 25 years ago here in Davos. So to start us off, please remind us of some key milestones that Gavi has achieved in its quarter of a century of existence. And how does your organization innovate to deliver vaccines to those who really need them the most? And how has that approach evolved over your 25 years in operation?
Well, thank you very much, Magdalena, for wishing Gavi happy birthday. And thank you, Prime Minister, for reaffirming your support for Gavi and the Global Fund. Gavi, as you know, is an international public-private partnership. Our mandate is to provide access to vaccination for the lowest income countries of the world. And we also provide access to vaccination during public health emergencies. And 50% of our portfolio of vaccines is deeply relevant to climate-sensitive diseases. So in terms of what we've achieved, in terms of the milestones, I'd like to briefly talk about 3 things. The first thing is the focus on results. Gavi is an organization which has delivered considerable results over the last quarter century. It's vaccinated over 1 billion children. It has saved over 19 million lives. And it has accrued $250 billion worth of economic benefits to the society. For every dollar invested in Gavi, you reap $54 of economic benefits. And it delivers these results at very low cost, at less than 3% of the operational costs. And Gavi has played a very salient role in contributing to halving child mortality since its creation. So that's the one attribute of Gavi, its focus on results. The second attribute of Gavi is its focus on innovation, and it being quite a pioneer in that space. The Prime Minister talked about public-private partnerships and their potential to forge innovation, and I couldn't agree with you more, because it's only when the public and the private system come together that you can actually innovate for scale. And Gavi has demonstrated that. To give you an example, Gavi's invested in financing innovations. So it was the first organization, and perhaps the only, to launch a vaccine bond. That vaccine bond has been consistently oversubscribed. We've raised over $6 billion from the vaccine bond. And it has really enabled Gavi to front-load financing, to make them available in a timely manner in the poorest countries of the world, to make vaccines accessible. Another example of innovation and the manner in which Gavi has exploited public-private synergy is its partnerships with the pharmaceutical sector. As you would know, we've got two CEOs on the panel with us here today who will bear me out. Gavi has engaged with the private sector pharmaceutical ecosystem very actively. In fact, market shaping is one of the core objectives of Gavi. And through that function, through the advanced market commitments, Gavi has been able to drastically reduce the cost of vaccines. To give you an example, in an OECD country, the cost of vaccinating a child for the basic suite of childhood vaccines is around $1,200. And in a Gavi-supported country, thanks to the hard work of my predecessors and the donors that support Gavi and its governing bodies, the cost of a vaccine as opposed to $1,200 is $28. And that's a huge impact, reducing the cost of vaccines, ensuring that they are accessible to those who need it the most. And I think in that function, Gavi has really been true to a statement where you are born should not determine whether you live or die. And I think that has really demonstrated that it's possible to achieve that. Through Gavi's market-shaping function, it also has accelerated access to vaccines. So if today a vaccine is available in an OECD country, the poorest country in the world can demand the same vaccine on the same very day, and it'll be possible for us to make it available within a matter of months because we have the systems and structures in place to do that. So the second attribute of what Gavi's delivered is public-private synergy for public good. And the third attribute of Gavi, in terms of what it has delivered, is a little bit of an untold story. It relates to the manner in which sustainability is hardwired in its model. So when Gavi starts supporting countries with vaccines and introduces them, countries start co-paying. And as the economic situation of a country improves, their share of co-pay increases. And ultimately, they graduate from our model completely, from our support completely. So of the 78 countries that were initially within Gavi support, 19 have graduated. Very large countries have started paying for their vaccines totally on their own. And we say on a lighter note at Gavi that our ultimate aim is to run ourselves out of business. So perhaps in 2050, one of my successors will come and be celebrating the fact that we've run ourselves out of business. So results, true public-private synergy for public good, and sustainability hardwired in its model are the three key things that Gavi has delivered on. And going forward, we are entering our sixth five-year strategy, starting 2026. We're accelerating our work. We will reach more children with more vaccines faster than ever before. And not just more children, more individuals, because we have vaccines we have the HPV vaccine for adolescents as well, and who knows, the TB vaccine is on the anvil. And we are significantly accelerating our work. And we are really thankful to our donors. Prime Minister, thank you so much. At the launch of our investment opportunity, the government of Spain announced that it will at least commit to a 25% increase. We're extremely thankful to you for that. Extremely thankful to the European Union and the Bill and Melinda Gates Foundation for hosting our replenishment event. And I think all of you are Gavi ambassadors. Really thankful to you for the support that they lend to our work.
Thank you very much, Sania. Some really important announcements and confirmations of support. I want to emphasize a couple of things because you gave us some really striking numbers. Correct me if I'm wrong, you said for $1 investment, there's $53 return, right? And then you gave this really tantalizing example of a cost of vaccine, $1,200 in the country that is supported by Gavi is $28, is that right? I mean, really, really impressive numbers. And I would like to suggest to you that in 25 years' time, even if you are so successful that you have achieved your mission, considering the dynamics that you have developed, how you perfected this public-private partnership model, and how you have demonstrated that you can drive innovation in a sustainable way, you will have a great deal to teach all of us in other models. So while your primary goal may have been fulfilled, there may be other goals for you to continue on. But perhaps we can all come back in some time and review that prediction. Let me stay with you for one more minute. One of the things that you mentioned, if I recall correctly, at the beginning of your statement, was the very large proportion, was it half of your vaccines target diseases which are related to climate change? Now, of course, that is a continuing threat that is becoming greater and greater in magnitude. Can you comment on what does that mean for the future direction for Gavi, and also the inevitable question, the pandemic, COVID-19 pandemic, although of course behind us, is still very recent in our history. From your perspective, what have we learned? Have we learned important lessons? Are we taking them into the future for the next pandemic?
So thank you. With reference to what you said initially, we talk about Gavi with humility, and of course there's huge opportunity for mutual learning, and we are always open to learning from other organizations and sharing our experiences. With reference to what you talked about, the 50% of our portfolio being relevant to climate-sensitive diseases, that is indeed true. We do not carry the climate-sensitive disease label very visibly, but the fact of the matter is that 50% of our vaccines are deeply relevant to climate-sensitive diseases. So, for instance, when climate ravages unleash, and I'm originally from Pakistan, I've seen what floods have done, wiped out, a size equal to the size of the United States, of the UK, for instance. Hugely, hugely devastating. And it is in those settings that diseases like cholera become a huge problem. Talk about temperature changes, and vectors develop habitats in places where they're usually not prevalent. And what does that mean for diseases like malaria and yellow fever? So that is where the respective vaccines become hugely relevant, because they create the resilience and enable us to prevent outbreaks and emergencies. You also talked about pandemics and what we've learned. So of course the pandemic had learnings for countries, for regional entities, for global health institutions. And within the global health space, we all have our defined areas of work, and we do not duplicate. And each one of us had our own set of learnings, and I'm sure Peter will tell you about his own set of learnings. During an emergency, the World Health Organization is the steward, and the various global health entities align behind the World Health Organization in responding. So in terms of Gavi, there were 3 key learnings for us. The first learning was that there isn't liquidity available immediately when a pandemic strikes or when there is an emergency. And learning from that, Gavi put in place what is called the Day Zero Financing Facility. This is a $500 million fund which makes liquidity available at day zero when a global public health emergency is declared. And this $500 million fund can be supplemented with 2 credit lines of $1 billion each from the European Investment Bank and from the US Development Finance Corporation. The idea is that if a pandemic strikes and if a vaccine is available, that we should be able to mobilize quickly and we should be able to procure the vaccine to make it accessible to wherever it is needed to protect the world, to protect people, to protect communities. And subsequent to the establishment of the Day Zero Financing Facility, we were able to invoke it for the first time when the pandemic, when Mpox struck. So I'm very pleased to be able to let you know that we acted very quickly, and within a month of the public health emergency being declared, we had ordered the largest consignment of vaccines, and they're actually on the way to the African continent where they're needed. So we learned a lesson from the pandemic with respect to the lack of access to finances for vaccines. We put in place a mechanism and a structure, and of course it goes with its governance and its management and its operationalization. And we also tested it during Mpox. I hope we won't have to use it again, but unfortunately the evolutionary trends of pandemics are such that we will unfortunately continue to face them. And we are there to protect people, to be responsive to the needs of countries. That was the first thing we learned. The second thing that we learned was relevant to Africa. You know, Africa was behind the line when it came to access to vaccines. And learning from that, Gavi put in place what is called the African Vaccine Manufacturing Accelerator. It's a $1.2 billion financing facility which is meant to promote sustainable commercial vaccine manufacturing on the continent. Of course, it's an aspiration of the continent and the African Union to be vaccine sovereign. And of course, there are many factors that interplay into that. But AVMA, as we popularly call it, the African Vaccine Manufacturing Accelerator, is one part of the response as well, an important part of the response. The money exists, the fund exists, and of course the payments are supposed to be made according to certain rules and procedures and milestones. And they are meant to provide African manufacturers with a level playing field because of course their initial cost of production is envisaged to be much higher. And we can be responsive even today if somebody meets the criteria. And the third lesson that we learned was that we must invest in our core work. We must invest in our core work. We must do it better. We must address the difficult pockets of vaccination that exist not only in fragile settings and in humanitarian settings and in climate change afflicted regions, but also in large countries in difficult pockets. So we are trying to get better at retweaking our tools and policies and procedures and our funding instruments to be able to respond and hone our routine immunization systems, because that is the railroad on which you will use during a pandemic as well. So there are these 3 things, to be specific, that we learned, and the 3 particular responses that we're quite further along in putting in place. But for many other agencies, there are the lessons as well.
Thank you for this. I think that's a really important lesson of keeping your eye firmly on these different aspects of your focus in parallel and continuing to support them. You talked about finance, you talk about very specific emergency situations, but also the more, if you like, core bread and butter focus, which of course has to remain as part of focus. Peter, I would like to turn to you. Let's talk about Global Fund. So of course, very strong track record of supporting countries to combat infectious disease. But we continue to be faced with drug resistance, climate change, we've just been discussing in quite some detail. So that's pushing back the progress. How will innovation in new technologies change the picture in your view and our ability to progress? And what's the experience specifically of the Global Fund in accelerating adoption of these new innovations?
Well, to start with, I may not look it, but I'm the younger sibling. The Global Fund was created in 2002, a couple of years after Gavi. So happy birthday from your younger sibling. We share a building, we share a lot of facilities. We work very, very closely together. Since 2002, the Global Fund partnership in fighting HIV, TB, and malaria has cut the mortality rate across the three diseases by 61%. That means 65 million lives have been saved. To put that in the context of an individual country, if you take a country like Zambia, in 2002, life expectancy was 43. By 2019, life expectancy in Zambia was 58. So a 15-year difference. 2/3 of that increase was due to the reduction in mortality of HIV, TB, and malaria, and a big chunk of the remainder was due to vaccines being made available. So these two organizations have had a massive impact on saving lives and increasing the life expectancy of people, particularly in the poorest and most marginalized communities in the world. Now, a big part of how that has been achieved has been by providing access to innovations. And in the same way that Gavi focuses on accelerating affordable access to vaccines, we focus on accelerating affordable access to sort of everything else, be it diagnostics, be it treatments, be it things like bed nets. The most obvious sort of big example of this is antiretroviral treatment for people living with HIV. When the Global Fund was first created, it was basically unaffordable and unavailable in many parts of the world. It cost about $10,000 per person per year. With the very latest price reductions, we're now looking at $37 per person per year. And even 2 years ago, that number was nearer 60. So it continues to come down quite dramatically. But antiretroviral treatment is just one example. A more recent example I'd give is the rollout of dual active ingredient bed nets. What's happened is mosquitoes have become resistant to the conventional insecticides. So the new nets have 2 insecticides. And over the course of the last 18 months, basically most countries have moved from conventional bed nets to these dual AI bed nets. And we use advanced market commitments and all that kind of stuff to work with the manufacturers to ensure that these new nets cost 70 cents more than the old nets, but are 45% more effective, which is a fantastic deal. And I do think it shows something about what we've learned from COVID and how we work with partners now, in that the last transition of bed nets took about 10 years. This transition of bed nets took about a year. And this is pretty big scale. I mean, we buy 150 million bed nets a year. We're half the global market. Looking forward, there's just a profusion of really exciting technologies across all 3 diseases. The one that is probably the most exciting is the emergence of long-acting injectable PrEP. It's a bit of a mouthful. Effectively what it is, if you're looking at it from a patient perspective as opposed to a scientific perspective, is it's functionally equivalent to a short-acting, 100% effective vaccine. You take it every 6 months. This is a drug called lenacapavir, and it is incredibly effective. It's not available yet. but it will be available in low and middle income countries at the same time as it's being rolled out in the richer parts of the world. And we are working with partners to ensure that we can get it to millions of people very quickly. Now, in all these things about accelerated access to innovation, there is the kind of all the stuff around working with generic manufacturers, the pricing, the volumes, all the sort of technical stuff. But there is also the very practical stuff of how do you actually get it to the people who can most benefit? And that's where also a very important aspect of the way the Global Fund partnership works is our partnerships with civil society and communities, because it's on the ground that you have to get that pickup and utilization of it.
So this really resonates very much with what Vas was talking about in the context of what Novartis is doing, right? That sort of multi-stakeholder approach, yes, exactly, and engaging with the communities. Yeah.
Yeah. When we look forward, I think the challenge we face is that there is so much innovation, and how do we pick the things and focus on the things that will make absolutely the biggest difference? And also, how do we resources? Gavi has its replenishment in sort of March-ish. We have our replenishment we fund on a 3-year cycle coming up later in the year. We're very appreciative of the continuing support of Spain and our other donors. But knowing the real fiscal constraints that donors face, and also the fiscal constraints that implementing countries face. Like Gavi, we have co-financing requirements, but we also know that the demands on the budgets of ministers of health are enormous and very difficult to meet. We've always had a big contribution from the private sector. In our last replenishment, we secured pledges of 15.7 billion, and 1.3 billion of that came from the private sector. Those of you from the private sector, I'm afraid to say we're going to be asking for you to step up more because we need you to. We're going to be looking for a couple of billion, 2 billion from the private sector, because we don't see where else it's going to come from. And if we are going to be able to sustain the progress we're making against the diseases, we're going to have to keep funding it. And although, Vas, I mean, you're absolutely right, more people now are dying of NCDs, and the burden of disease of NCDs in our middle-income countries is recognizably increasing. In a way, that's a mark of the success we and Gavi and others have had on infectious diseases. People are living long enough to get the NCDs.
That's a very, very good point. And Peter, if I may just stop you there for a second, and actually thank you for being so candid and so open about that call. You've been forewarned that this is coming. I have another question for you, but let me hold it for 1 second. I want to go to Adar to explore this innovation and technology thought, and I'll come back to you and then once again to Adar. So the Serum Institute of India, am I right in saying that you are the largest vaccine manufacturer in the world?
Yeah, that's, sorry, is this mic working? That's accurate, but only in terms of volumes, you know.
That's what I mean. That's what I mean, exactly. So in that context, keeping that fact, that statistic in mind, tell us how your organization is leveraging and making the most of technology in innovation at scale, to scale the production further, of course, keeping in mind that goal of equitable access.
Well, firstly, thank you for having me on this esteemed panel, and I just want to take the opportunity to thank the Prime Minister for his continued support, you know, to Gavi and other multilateral organizations. And it's particularly important for other world leaders also to step up, in fact, given especially the news we heard from the US on withdrawing, you know, support from the WHO. And it's you know, the impacts of all the work that an organization like WHO does in terms of world health systems and maintaining global standards for vaccines, medicines, diagnostics, testing, surveillance, all of that. This is very critical, especially if we're talking about, in the future of preparing for pandemics and whatnot. So I think that's very important, and I think if, other world leaders could step up to bridge that gap, I think that is something that everyone would welcome. Coming to your question, we're a privately listed company, so we don't have stakeholders and investors that we're accountable to. That kind of gives us the freedom to price our vaccines and give global access and equitable access to as many, especially the poorest countries of the world. So we sort of run our operations in a semi-philanthropic sense, just about making enough profit to reinvest in our CapEx and clinical trials for the new vaccines that we want to make. The way we do it is have large, huge factories building tremendous economies of scale so that we can afford to give the vaccines at $1 or $2, whether it's all these vaccines that, Gavi and the African nations have been taking. And of course, combined with technology that we keep upgrading to improve efficiencies, but it's really economies of scale. So we only look at a vaccine if it has a global requirement of 100, 200 million doses. Otherwise, it doesn't justify putting up a facility, because if you make a 20, 30 million dose kind of facility in these regional areas, you can't really bring the prices down, and then that's not good for anyone, so in terms of access.
So that's a really important comment to keep in mind in those international discussions where vaccines are manufactured, especially in the context of a global threat like a global pandemic. What's the most effective way of manufacturing vaccines for global delivery? And of course, your argument is for scale. That's a very persuasive argument. And I recall some very sensible discussions that, for example, at a time of a pandemic, as we were during COVID-19 pandemic, governments were faced with a dilemma of sharing the vaccines that they were manufacturing as opposed to providing sufficient amount for their own nations that they arguably and understandably may need to prioritize. But this is an important point. And thank you also for reminding us, referring to what Prime Minister was saying at the beginning, that of course we're talking about global health. There is a need for global governance, and there is a global responsibility here. And you very appropriately called on other leaders to join the example of Spain here. So let me move on to the next question. And the next question inevitably is about COVID-19. So my question is about the lessons that you specifically, in your context, have drawn. And can you speak to the role of public-private partnerships that we've heard about so much already on the panel? How do you see them accelerating vaccine development and distribution?
Yeah, so, from the lessons, I think it was very clear. We saw some of the successes and failures during the pandemic, both from whether it was private sector or where governments could have come together more in a global sense, to standardize regulatory policies, vaccine certificates. You had just to give you a few examples of what I think we can do better, and again, it relates to maybe something the WHO is working on with the pandemic accords, if the countries could sign up to that, and I don't know now what's going to happen with what's happening with the WHO, but I think if they continue, I'm sure, to get everyone together to sign at least an understanding that, God forbid, there's another pandemic in the future. Of course, world leaders of countries have to look at their own constituents, protect their nation first, but also play a role where a certain amount of capacity of whether it's raw materials, vaccines, things like that can be shared. I think in this pandemic, there was that panic where everyone was wanting to hoard, vaccines and raw materials. we didn't have unity and consensus on regulation. So if you had clinical trials done, you had a vaccine approved by the WHO or the UK or Europe, it wasn't approved by the US and vice versa. So again, that restricted access where certain manufacturers could have supplied vaccines to certain regions and countries, but they couldn't get it because those countries weren't approving it. So, you know, if there's unity where, you know, one could say or suggest that if you take the top 4 or 5 regulators, the US FDA, UK MHRA, EMA, and the WHO, that if a vaccine during a pandemic is licensed based on clinical trials and all the other scientific data, you know, that should be then allowed to be used unilaterally in all the countries. And as I said, you know, travel documents and restrictions, which created a lot of havoc also to the public. These were some of the lessons. And of course, sharing of raw materials, resources, and vaccines. If there's some kind of consensus, you know, then I think we'd be better prepared. And, you know, a lot of these countries now have a very good infrastructure of surveillance. So whatever was invested during the pandemic in terms of the ability to test and diagnostics and all of that and survey, that exists. So, you know, going forward, God forbid there is something that is spreading, we'll know about it much sooner and we can act and respond faster as well.
So this is a really important addition to one of the comments that Sania, for example, made about the preparedness in terms of rapid deployment of finance capability. Now you're talking about the lessons about regulation on the international level, and we had not had this aspect of conversation on the panel here. Particularly acute in the context of the pandemic, but of course equally important when we're talking about rolling out treatments, diagnostics in a different setting. Peter, I promise I'd come back to you very briefly. I'm going to ask you effectively the same question, but from the opposite side. In your view, from the Global Fund perspectives, are there lessons from the COVID-19 pandemics that we should have learned that we still haven't learned?
Unfortunately,
maybe just one.
Yeah, I'll give you one lesson. And it's a lesson that actually those of us who've been involved in the fight against HIV long ago, but we keep having to relearn, which is that if you don't have the people who are most directly affected by the disease involved in designing and delivering the responses, you won't be as effective. And it is still a bit of a problem that whenever we have a new threat, we tend to take a very technocratic top-down approach. And I think we need to move faster in engaging the communities most directly affected, because that makes things so much more effective.
That's a really, really beautiful comment, actually. We've heard a lot about collaboration. Of course, collaboration is the theme for this year's annual meeting. What I sense in your comment is almost moving beyond collaboration to co-creation with these, with the civil society. Thank you.
Could I add one point to Peter's point?
Sure.
In just 30 seconds. All inter-pandemic funding for vaccines and drugs that could be used in future pandemics has completely stopped. And because of the market failure that is the reality of pandemics, take a company like Novartis. We were working on small molecule pan-coronavirus inhibitors. We have no funding for it, so we just shelved them all, which puts you years behind when the pandemic comes. And it's the governments forgot already that there was a pandemic.
We need that long-term vision. That's right. We need the long-term vision, a very, very important point. Thank you for your comments so far. I would like to invite Dr. Klaus Schwab to come and join us to make concluding remarks. If there is time, I will have some other questions in the end. Please join us.
No, thank you very much, Prime Minister, distinguished partners, I have to say. I'm particularly proud of this session because I feel very close, not only to the issue. I mean, 3.6 billion people do not have yet real access to adequate conditions in health. But The forum takes pride in saying that somewhere we have been at the origin of your organization and also of Gavi, of course, later. And I remember how I was sitting together with Bill Gates and Madame Brundtland, who was the Director General of WHO at that time, and we gave birth to those initiatives. So if I look now at the theme of this meeting, preparing for the intelligent age, we will see many great impacts, certainly, of artificial intelligence on the whole health sector, and the World Economic Forum will be very much engaged and involved. But I think there are some fundamental issues which can only be addressed by public-private partnerships. And that's what we are standing for. And for this reason, apart from looking at how we engage all those new technologies in the health sector, we are also involved still in very traditional ways, like the digital health transformation, Global Alliance on Women's Health, Climate and Health Initiative, Global Health Equity Network, and Partnership for Health System Sustainability and Resilience. All those areas require the engagement of business and the support and endorsement of the political instances. And that's what the World Economic Forum stands for. So I just wanted to express my appreciation and my pride, if I may say so, for what has been achieved. But I think the obstacles, or not the challenges, are coming now. And Peter, I wish that you are very successful in preparing the next phase of the Global Fund. So again, thank you.
Thank you. Thank you very much for reinforcing the conversation that we've had here about this importance for private-public partnerships and collaboration. It was very clearly emphasized by a number of panelists how more innovation, in-depth innovation, different type of innovation can emerge precisely as a result of that collaboration. Of course, collaborations within sectors, within models are equally important. And from my side, I would like to emphasize that that collaboration between public and private sector doesn't just start at the implementation phase. It starts at the original fundamental research stage as well. So it's the whole pipeline, right from the very beginning through to the delivery of its outcome and round again. So really, really important issues. We discussed how important governmental leadership and support is. Fantastic examples from Spain here. Thank you, Prime Minister. How important the private sector leadership, but also those organizations that really embody and themselves are private-public partnerships in and of themselves. And very importantly, a number of examples illustrating how in that partnership we have to make room and we have to include the civil society. Otherwise, what we design, the solutions that we design, are going to be less effective than their true potential. At the end, I mentioned the word co-creation, which hasn't been mentioned so far, but in my view, it can be viewed as an extension of that collaboration, taking it really to its fullness. We have 1 minute left, and there was one statement that was made at some point, and perhaps Professor Schwab just alluded to it without giving the specifics. I think, Vaz, you mentioned it, Global Fund for Non-Communicable Diseases is what's needed next. Do you want to just make a final comment to tell us a little bit more about this tantalizing throwaway comment?
Well, look, I think if you look at the history, the reason we were able to accelerate the introduction of vaccines, of ARVs, of malaria, all of the interventions Peter mentioned, was because we created these incredible institutions that could bridge the gap, create the financing mechanism, work with the private sector. I think it's unrealistic to think that diagnosing and treating chronic diseases will happen in very stretched healthcare systems on their own. I don't know what the right mechanism is, but I think some thought, real thought has to go into how can we get these technologies already now starting to be introduced. And I think we have two beautiful mechanisms here that prove it's possible. And I think it's time we start to do that for non-communicable diseases.
Thank you. In a completely different setting, yesterday I had a quote which says, "Believe in the beauty of your dreams." So here we have a forward-looking mission. Thank you very much to my distinguished panel, and I'll leave you with the comment that global health is, of course, a global concern, so relevant to all stakeholders. It's our responsibility, it's our opportunity. Thank you very much.
Thank you.
Thank you.